Hello, so we're here with Olympia Tsilochristou from King's College London, who has just published a study on Staphylococcus aureus and food allergy in early childhood. Olympia, please introduce yourself and your research a little bit.
Thank you very much. So indeed, my name is Olympia. I'm a clinical researcher based at King's College London in London, and my main field of interest is food allergy, and particularly risk factors of the development of food allergy in patients with eczema.
Great. So this new study, what is the significance of the findings in terms of our understanding of the onset of food allergies in childhood?
Sure. Yeah, that's the very hard question. So, Chiara, we know very well that eczema, especially the severe eczema, is associated with the development of food sensitization and allergy in young children. So what this study adds to the whole picture is the fact that we have managed to demonstrate that Staphylococcus aureus, or in short Staph, a very common bacterium patients with eczema get colonized with, is actually a risk factor for the development of food allergy together or aside or in parallel with eczema.
Your results are based on the LEAP study. Do you want to explain what these are?
Yes, sure. So the LEAP study, this groundbreaking study that changed the guidelines in terms of early introduction of highly allergenic foods in infants, was a great opportunity for us to be able to sequentially check the development of food allergy and to correlate that with the skin culture results or even nasal culture results, especially with regards to Staphylococcus aureus. So what we have shown in this study is that children that had skin Staphylococcus aureus had a very high production of IgE antibodies against peanut as well as egg white as well as milk. And this is highly important because as far as egg white and peanut, we actually corrected our results for eczema severity. So they are not confounded, statistically speaking, by eczema severity. At the same time, we also demonstrated that the children that had Staphylococcus aureus colonization actually had higher chances of developing peanut allergy by the age of 5 or 6, and these quite interestingly was very important when it came to children that were actually being fed with peanut as part of the LEAP protocol. So we showed that these children actually had difficulty in gaining tolerance to peanut despite the early introduction of peanut in their diet. And our results also demonstrated that children that had Staphylococcus aureus colonization actually had a persistent egg allergy until the age of 5 and 6, which is very interesting because we know that typically most children will outgrow their egg allergy by that age.
Very interesting, Olympia. What should researchers in food allergy consider now as the basis of your results?
Yeah, so we certainly believe that any future studies trying to induce and maintain tolerance to foods in young infants should consider colonization with Staphylococcus aureus as a risk factor for trying to inhibit such tolerance mechanisms. Yes.
Thank you very much.
Thank you for the opportunity to discuss about my results.